everyone. My name is Daniel Clark. I'm 27 years old and I'm from Mount Pleasant, Iowa. I'm running for U.S. House to bring the social and economic priority of this country's elected officials back to the working class people, not corporations. I was a Bernie Sanders national delegate to the Democratic National Convention, and his fight, one that he has been fighting for decades, inspired me to run for office myself. The working class people of this country are ready for someone to put their needs over corporations, personal gain, and partisan lines. I belong to no party. I don't take PAC money, and this is a grassroots, volunteer-driven, small donation-oriented campaign. Healthcare, affordable healthcare, shouldn't be a privilege, but a right. That's why our campaign is fighting for Medicare for All. Under a Medicare for All system, all residents of the United States would be covered for all medically necessary services, including doctor, hospital, preventive, long-term care, mental health, reproductive health, dental, vision, prescription drugs, and medical supply costs. 95% of all households would save money under a Medicare for All system. Copays, deductibles, and premiums would disappear. A study at George Mason University estimated that switching to a Medicare for All system would save the American people $2 trillion over a 10-year period. Living wages are essential to quality of life, and that's why they are important to our campaign. Living wages are a level of pay that allows an individual to afford adequate shelter, food, and other necessary basic needs. Employees who earn a living wage are more satisfied, which helps reduce turnover in the workplace. Currently, our minimum wages in this country have not kept up with inflation and are well below living wages. In a country where we can give trillions of dollars in tax cuts for the rich, we are more than capable of paying our working class living wages. Ending the prohibition of cannabis or marijuana is another important cause for our campaign. Legal cannabis would raise a substantial amount of revenue for federal and/or state governments. A study done by New Frontier Data released a report in 2017 that the immediate legalization of cannabis at the federal level would lead to over $130 billion in revenue between 2017 and 2025. Legalizing cannabis would also, according to that same study, lead to the cumulative creation of over 1 million jobs. Removing cannabis from the controlled substance list would reduce the number of court cases that go to trial and lead to fewer incarcerations. That doesn't even begin to shine a light on the expansive list of medicinal benefits of cannabis, from reducing pain in patients with MS, spinal cord issues, cancer, to arthritis. It's also been proven that CBD products have been very effective at reducing the frequency and severity of epileptic seizures. Thank you for taking the time to listen to what our campaign is about. If you would like to learn more, please visit our website at www.danielclarkforcongress.com, where you can also register to vote. Don't forget to vote on or by November 6th. Thank you.